Hello everyone. Today's video is another Q&A video. Going to be talking about elevated tin levels in a person's body, talking about treatments for Lyme during pregnancy, and also talking about, what's the last thing? Something to do with H. pylori. So before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need healthcare advice or medical advice, please talk to your healthcare provider to get that advice. So the first question I have up here is, could I ask information in late Lyme what medicines are used in pregnancy and what herbs or other supplements are allowed and could be used for treating Lyme in pregnancy? Does cryptolepis affect hormones, and does it increase sweating because of that? So yeah, thanks for the question. With Lyme and pregnancy, I've had several patients over the years who have become pregnant while being treated for Lyme or co-infections for that matter, but not many, so it's not an area that I specialize in, but I thought I'd answer the question anyways because I'll share what information I do have. So there are certain antibiotics that are not safe to take during pregnancy. Sometimes it's a bit of a weighing out the issue or weighing out the costs benefit ratio sort of thing depending on the individual case. If there was like really severe systemic Lyme, like encephalitis or something like that, it's like there's going to be certain difficult decisions that might need to be made, maybe using an antibiotic that's not safe for the baby, but you've got to save the mom's life. So there's obviously going to be certain challenging situations like that, but by and large, there are options that are typically safe during pregnancy. So like for example, and again, not giving any advice here, obviously I have to talk to whoever's prescribing the antibiotics in question, but generally like doxycycline would be avoided in pregnancy because that's something that can lead to certain fetal defects or negative impacts on a fetus. However, a drug like amoxicillin, as long as the patient's not allergic to amoxicillin, can work very, very well, and that is typically safe in pregnancy. Again, case by case basis. So there are different pharmaceuticals that can be used safely. So that would generally be the only route that I would recommend that one of my patients follow. Taking a pharmaceutical approach, using drugs that, as best we can tell, are safe during pregnancy. As far as herbs like cryptolepis goes, we just don't have really any research literature telling us whether or not these drugs are safe, or these herbs rather are safe or not. So for my patients in my practice, I advise they not take any of those herbs, while they're pregnant, just to err on the side of caution. There are certain supportive therapies that I would consider for my patients, aside from putting them on probiotics, while pregnant, if they're on antibiotics for Lyme. On that list would be low-dose immunotherapy. With low-dose immunotherapy, not that every patient needs low-dose immunotherapy if they're dealing with Lyme, but if it's more of a chronic case, then that is a therapy that I feel quite comfortable with, because while it is very different than homeopathy, it is very, very diluted, just like homeopathy, and homeopathy seems to be one of these therapies that is, by and large, safe to work with during pregnancy. So again, case-by-case basis, but I really, really limited tools in the tool bag, and to my knowledge, there's no published data telling us that it's safe to use this or that herb during pregnancy. So yeah, hands are really pretty tied, pretty limited with therapeutic options in pregnancy. So we're going to move on to the next question. So the next one was, just finished triple therapy for H. pylori 4 days ago, feeling slightly better, but still having stomach pains and diarrhea with some blood. Is this normal? I'm taking probiotics, just want to know if this is normal, as it's worrying. So again, can't give any advice based on, for anyone over social media, but just thought I would chime in by saying that many of the patients that I've worked with who work with triple therapy for H. pylori, they will need to repeat that triple therapy again in some cases. Sometimes they have to do the treatment like 3 or 4 times, and even sometimes then it's not totally gone. It's part of the reason why with my patients I'll typically recommend that they work with some adjunctive therapies at the same time, something like mastic gum, maybe also ideally, if possible, testing them for SIBO, because that can be a concomitant issue with H. pylori, and whether one feeds into the other is, maybe debatable, but they do coexist in a lot of cases, and just making sure that we're treating as comprehensively as we can for whatever's going on in the gastrointestinal tract. So, it's not unheard of by any stretch to not have a full resolution of symptoms with H. pylori after triple therapy, but of course that's not supposed to be the case. It's supposed to just work really well, but sometimes it needs to be repeated, and adjunctive agents at the same time can be helpful. I will just say that, with H. pylori, I've treated a lot of patients with H. pylori. I mean, some of them are totally asymptomatic, a lot of them are not, but it's with H. pylori, it's typically more, your typical gastritis symptoms, like local, upper abdominal pain, maybe like a gnawing feeling there, maybe some symptoms that are worse especially with certain foods, like especially acidic foods, and so, in terms of seeing like diarrhea with blood in it, that's not a common thing that I've seen in my H. pylori patient. So I'm not saying that it's not related to H. pylori, but sometimes there's more than one thing going on, and it could be H. pylori plus something else going on. So, if I had a patient in my practice and they had H. pylori, but they also had, bloody diarrhea, I would be working them up to make sure there wasn't anything else that was going on as well. So I would probably run a stool test and see what's happening with their gut microbiome and kind of go from there. So thank you for that question as well. And the last one here is, so it says, my daughter tested at 50 times the safe human levels for the heavy metal tin. The range was less than 3, and she tested at 150. Right now, we're testing our water system in our house to figure out what the source of the tin is. EDTA is going pretty slow, EDTA being a chelating agent that can be used to remove tin. Tomorrow, we're going to ask to move to DMSA, which is another chelating agent. I think that's what it is DMSA what you would use. So when it comes to chelating tin, both EDTA and DMSA are options, so they're both valid options. With EDTA, it can be administered different ways, orally, intravenously. There's EDTA suppositories. I think there's some companies that make EDTA creams. To my understanding and my experience, EDTA really works very reliably when it's intravenous, and it's, in my experience, more debatable whether it works as a suppository. Oral EDTA, to my understanding, doesn't really work because of very, very poor bioavailability. Maybe liposomal EDTA works, and I just don't have any experience with that. I haven't seen any research literature looking at it, so I can't really speak to that. But intravenous EDTA, to my understanding, is the most direct way to get rid of tin. That being said, oral DMSA is another very valid option for that. When it comes to tin, I've had not many, I'd say maybe half a dozen patients, less than a dozen for sure, where I've seen really high levels of tin come up on a provoked heavy metal test. And my best guess as to what's going on there is that the tin might be coming from a prior mercury amalgam. Even nowadays, if you're eating things out of like quote unquote tin cans, like to my understanding, they're largely made out of aluminum. They're not made out of tin, as they don't think they have been for a long time. Now, I'm not an expert in cans, so I could be wrong on that, but that is my understanding of it. So it's like, where the heck would the tin be coming from? And checking the water supply, sure, if a person's working in some type of a industry where they're working with different metals and alloys and things, like maybe there's tin in various places. There are other sources of exposure to tin, but tin is one of the metals that is used in a mercury amalgam. It's typically silver, tin, and mercury, of course. And so that's what I hypothesize in terms of where the source is coming from, because with the patients that I've tested where I have seen elevated tin, their baseline level of tin has always been normal. It's the post-chelation level telling me that it's not coming from their immediate, water supply or day-to-day exposure. It's, something that's built up in their tissues. So just point of interest that tin is something that's found in amalgam fillings. So thank you for that question as well. So I'm going to leave it there for now. If anybody has any questions on any topic related to human health, please post in the comment section below, and I will do my best to answer as soon as I can.